Assalamu alaikum, respected viewers. I'm Dr. Muhammad Ansari, consultant child specialist, and today I have chosen a very brief topic for my junior doctors and medical students how to differentiate between or what are the differences of breastfeeding jaundice and breast milk jaundice. Breastfeeding jaundice, also called breastfeeding failure jaundice, and breast milk jaundice is because of presence of an enzyme in the breast milk in mother's milk, which is glucuronidase enzyme. Glucuronidase enzyme deconjugates conjugated bilirubin, which is direct fraction of the bilirubin, and it converts into indirect bilirubin, which is fat soluble and is easily reabsorbed across the terminal ileum or terminal gut, and enterohepatic circulation is increased, so the child keeps on having jaundice. This enzyme is secreted in almost all women, and the occurrence of jaundice is multifactorial. Some women have more amount of glucuronidase enzyme in their breast milk, or they have chemicals which act like glucuronidase enzyme. Although the exact theory is not clear, but this seems to be the probable cause of breast milk jaundice. Whereas breastfeeding jaundice, on the other hand, is because of lack of breastfeeding, lack of feeding. When the child is not receiving adequate amounts of milk, whether it's a breastfeeding breast milk or whether it's a formula milk, and there is inadequate absorption of jaundice, direct bilirubin onto the heavy proteins which are in milk, and that's why it's not excreted in the feces, and instead it is repeatedly reabsorbed into the bloodstream, and this reabsorption leads to increased bilirubin level in the blood and plasma of the baby, and thus manifests as jaundice. Here I want to tell another thing that jaundice appears at 2 milligram per deciliter level or at 34 micromole level in adults or in older children, whereas in neonates it appears when the level passes 5 milligram. So the level is slightly higher. So already when the child, when a newborn, when a neonate is jaundiced, it means already his level of serum bilirubin is approximately 5 milligram per deciliter or 85 micromole or higher. Presence of jaundice in first 2 days is pathological jaundice. If the jaundice level is more than 13, then this is pathological jaundice, which needs further attention. It needs further investigations. It needs further treatment. And if direct fraction of bilirubin is higher, it also needs further investigation and treatment. If it is associated with coagulopathy, this is also pathological jaundice. If it is associated with obstruction, if you suspect obstruction, so gamma glutamyl transferase is raised, or alkaline phosphatase is raised, and direct bilirubin is more as compared to the indirect, this is pathological jaundice. Or if 20% of the total bilirubin is direct bilirubin, then it is again direct hyperbilirubinemia, and it is considered pathological disease. If jaundice appears immediately after birth or in the second day, but there is hepatosplenomegaly, this is again a pathological jaundice. If there is more than 5 milligram per deciliter or more than 85 micromole increase per day in the serum bilirubin level, this is again a sign of pathological jaundice. So here I have told you the differences between the physiological jaundice and pathological jaundice as well. And I want to then again revise a little bit now what are the differences of breast milk jaundice and breast feeding jaundice. In children who are having breast milk jaundice, the children will be thriving, they will have good appetite, they will be getting good amount of milk, they will be well hydrated. Whereas the children who have breastfeeding failure jaundice or feeding failure jaundice, they will be dehydrated, they will not be thriving, there will not be appropriate weight gain in the previous weeks when you will assess the child, and there will be lethargy as well. there might be constipation, or there can be little bit of hunger stools. Hunger stools are stools which contain small amount of milk flakes, and there is free biliary secretions or intestinal secretions. So the color of the stools is yellowish or greenish. The children who are having pathological jaundice is also denoted by persistence beyond 14 days of life in case of full term deliveries, and in case of premature preterm babies, persistence of jaundice beyond 21st day of life is also considered a pathological sign. Meaning by it is a normal thing that jaundice persists for this many weeks. If the child keeps persist on having jaundice, this is called persistent neonatal jaundice, or also called pathological jaundice. Persistent neonatal jaundice, as I told you, have two main causes. Number one, breast milk jaundice. Number two, breastfeeding failure jaundice. So this was the educational video regarding differences of breast milk and breastfeeding jaundice. I hope it will be useful for your clinical practice, and I hope that it will be fruitful for your examination as well for the medical students. If you like my channel, please subscribe to it and recommend it to your friends and family members, so that I can keep on spreading the awareness about childhood and neonatal diseases among the community. Thank you very much. Salam.